Yes.
Sir, I'm just then going to refer on the topic of data and records to examples of information being provided to third parties, most commonly Oxford and the Oxford returns. We've already looked at some examples of the annual returns in relation to Belfast, which are not just the generic annual returns, but also contain detailed patient data with named patients, information about dates of birth and so on, the nature of their bleeding disorder and the treatment they've received. If we then look at BHCT 40850, this is a letter from the Oxford Haemophilia Centre from Miss Spooner, dated the 21st of October 1992 to Dr. Maine, Professor Bridges and Dr. Dempsey. It says, on reviewing the cases of AIDS or AIDS-related illness reported to us on Form AIDS 3, CDSC's Form AIDS 1 or the paediatric surveillance forms, we find it several months since we last had news of some of the patients. I should be most grateful if you could complete and return to me as soon as possible the enclosed form for your patients to give up-to-date information. The information will be treated in strictest confidence. The completed forms will not be passed to anyone outside Oxford Haemophilia Centre. And then if we go over the page, we can see an example of a completed form from Dr. Maine. So again, we've redacted the details of the individual patient. But it's headed confidential. UK Haemophilia Centre Director survey of patients with AIDS or AIDS-related illness. And then we can see information, if we go further down the page, about the patient's clinical condition and about their treatment being provided. And then further down the page, we can see under the heading additional comments, a number of matters set out about the individual patient. And as I say, although we've redacted the patient's name, the name and date of birth are there in the material that's sent to Oxford. That's one example where information relating to HIV or AIDS diagnosis is being communicated. If we go back a number of years and look at an example of another kind of data, HCDO 5054_005. We can see here in a letter from Miss Spooner to Dr. Maine dated April 1977, an expectation that Oxford will be sent a form giving names and details of patients. That was by reference to a particular cohort 5 von Willebrand's disease patients treated in Belfast during the year 1978. And then if we look at HCDO 40153_008, again, these are by way of example. We can see here we've moved forward to May of 1984, and it's Dr. Maine sending Miss Spooner information about the treatment received by identified named patients. And then if we go to BHCT 40861_003, we can see a request here coming from Dr. Ritzer to Dr. Maine, Dr. Bridges and Dr. Dempsey in December of 1986. It refers to a recent survey of anti-HIV and haemophiliacs and says the patient listed below attending your centre have reported as being anti-HIV positive in the 1986 survey, having been anti-HIV negative in the 1985 survey. In order to find out how this seroconversion relates to use of heated or unheated factor concentrate, I should be grateful if you could let us have some more details. And we can see the reason is for the monitoring of safety of heated blood products. So the requests may be entirely understandable requests. The issue that they give rise to, as we've seen with a number of other centres and clinicians, is the extent to which patients were aware of or asked to consent to or did consent to the dissemination of information about them. And if we look down the bottom of the page, we see that, again, this is a request relating to a specific named patient. If we then go to BHCT 40831_001. Again, we can see Dr. Ritzer asking for information. This is now January 1989, about a particular patient, trying to locate a death certificate, and information is requested. And if we go to the bottom of the page, to the handwritten note, it says, I am surveying all death certificates of anti-HIV patient positive haemophiliacs to see how many, I'm not sure what the next word is. Might have died of HIV-related illness, but not certified as AIDS. So again, an understandable reason, and this is in relation to a deceased patient, but raises the question of what patients or their families understood. If we go to BHCT 40831_003, I think we've only got the first page of this letter, but we can see it's a fairly detailed response from Dr. Maine to Dr. Ritzer, giving information about the patient and their circumstances. And then if we look at what Dr. Maine has to say about the provision of information.
Just, what's the date of that?
The date of the letter, if you go to the top of the page, it's February 1989.
Yes. And the cause of death there was liver failure related to a non-A, non-B hepatitis.
Yes.
Yes.
And of course that may cast into an interesting light some of what we've seen Dr. Maine saying in her statement about her understanding, and indeed in her correspondence in the 1990s, about the nature of hepatitis C. So if we go to Dr. Maine's statement at WITN 0736009, and we go to page 51, please, Shamit. Dr. Maine is asked a series of questions about involvement of patients in research studies. She says they weren't involved in research studies without their express consent. And then she's asked at paragraph 76 about patient data. Was that used for the purpose of research or any other purpose without express consent? She answers no. And then in relation to the sharing of patient data, anonymised or otherwise, with third parties such as UKHCDO or the Oxford Haemophilia Centre, she says this: all patients attending the centre were aware of the existence of UKHCDO. Top of the next page. They were aware that the Secretariat collected and compiled stats on an annual basis relating to their treatment, and they realised the procedures were necessary in order to estimate changes in treatment product availability year by year. In those circumstances, it was a matter of implied rather than express consent. Now, it may be right that patients had knowledge of UKHCDO. It may be right, I know not one way or another, that patients were aware of the UKHCDO Secretariat collecting and compiling statistics. It doesn't, I think, follow as a matter of logic or inference that patients must be taken to have been aware that named data, in particular sensitive data about matters such as HIV status or the progression of medical conditions, was also being provided to UKHCDO. And again, we've seen this is not an issue unique to Belfast. It's an issue that's arisen in relation to many centres, probably all of them, and one which UKHCDO itself was attempting to wrestle with at some stage.
But what I think it appears to be saying is that no one was actually asked to agree that this is how the information should be shared.
Yes.
Or shouldn't be shared.
And then I just want to pick up next on the issue of what was or was not recorded on death certificates. If we go to WITN 0736001, and we go to page 10, bottom of the page, Dr. Maine says this: it's important to point out that the universal practice throughout the United Kingdom was to omit HIV on any death certificate. However, it was important and prudent on all doctors concerned to inform the undertakers in question so that appropriate precautions could be taken. If we look at Dr. McNulty's witness statement, so WITN 0921001, and we go to page 8. What she says in paragraph 3.19, so bottom half of the page, is this: when dealing with the issue of death certificates, it must be noted that Northern Ireland is a small place and it's difficult to go somewhere without meeting someone you know. This is particularly true in rural areas, and the privacy and discretion which was paramount in the centre did not always filter down to those places. It must also be noted that 25 years ago there was a lot of ignorance and fear associated with HIV and hepatitis, and it was felt to be an act of humanity not to use those terms on the death certificate in order to protect the deceased and their relatives. Very often, she doesn't say always, but very often this was at the specific request of the patient or their family and was not done in any underhand way. So that's the evidence from those two clinicians about the approach taken to the completion of death certificates. Can I then turn relatively briefly to evidence relating to Dr. Maine's involvement in research? She describes in her evidence having undertaken some full-time research in the course of the 1960s and early 70s, but she says in her statement that once she returned to Northern Ireland and took up a post in the Haemophilia Centre, she had little, if any, time or opportunity to carry out meaningful research. There are examples of Dr. Maine participating in some studies, trials, or pieces of research. There are the two papers we've looked at in the Ulster Medical Journal in relation to hepatitis B and patients with HIV. There's some work and publications in relation to porcine products. Dr. Maine and I think Dr. McNulty had some involvement in a study in relation to the purity of NHS Scottish concentrates, or at least some anticipated involvement in that issue. If we have a look at MACK 301300_002, we can see Dr. Maine being sent a copy of a protocol for a PUP study in December 1988, and that appears to be from other documents in relation to a further Scottish product said to be purer than Z8. It's not clear what happened in relation to that study, I should say. Some other handful of examples of Dr. Maine's involvement are OXUH 40451. If we go to the second page, we can see this is a reference to UK-HCDA's Factor VIII inhibitor working party, and there's a trial of Factor VIII versus Autoplex. And it says a meeting of the participants in this trial was held in February 1982 in London, and then a number of participants listed, including Dr. Maine. If we look further down the page, there's reference to a discussion about a draft clinical protocol, and then the trial comprising a double-blind random allocation assessment of Factor VIII versus Autoplex. So that's, again, one example, at least, of anticipated involvement in a trial. If we then look at BHCT 40951, there's some evidence of involvement in a clinical trial. So this is the Concord trial, and there's a request there by the Medical Research Council for information relating to the patient's death. That's a request in September 1992. Dr. Maine's response, should perhaps go to this for what it may indicate more generally about her knowledge, is at BHCT 40948. We go to the second page. We can see in the first paragraph, so it's a letter, 30th of November 1992. She refers to, well, she says, apologises for the delay in responding to the letter regarding the patient enrolled in the Concord trial. She then gives a detailed description of his admission to the haematology unit. If we go over the page, or rather back page, these letters in the wrong order. Again, she gives further details leading up to the patient's death. If we just look at the third paragraph, it says this. In summary, severe haemophiliac who was a carrier for hepatitis B and hepatitis C who developed HIV illness, and then gives details of that illness. So again, we can see in relation to this patient at least a diagnosis of hepatitis C having apparently formerly been made by it's not clear, I think, whether it's made, I think it's made in life, actually. If we look further up the page, first paragraph on that page, the last 4 lines, it says he had liver failure related to his carrier status for hepatitis B and hepatitis C. So again, that may be an indication which casts some further light upon what Dr. Maine is elsewhere saying about the serious or otherwise nature of hepatitis C at this time. There's a reference, we can take that down, thank you. There's a reference, again, in one of the documents to Dr. Maine receiving some modest funding, £500, for a piece of work on the immune response for patients with haemophilia. That's from the Haemophilia Society. It's not known what that work then entailed. And then if we look at BPLL 305964, this is about provision of clinical data and not participation in any specific trial, as far as I can tell. But it's an internal memo, BPL memo, 19th of April 1991, and it says, I attach up-to-date lists of users of products formerly issued from PFL, mostly without charge, on the understanding that clinical data would be provided. And again, we've seen, I think, an example of this in relation to another clinician. There appears to have been some arrangement whereby some products were provided free of charge by two clinicians in return for the provision of clinical data. And then if we go 2 pages further on, there's a list of some 52 clinicians, but bottom of the page we see there listed Dr. Maine as one of them. I want to move next to a separate topic, which now post-dates Dr. Maine's retirement, which is in relation to the VCJD notification exercises. There is a very detailed account from Dr. Anderson in her recent witness statement, which I'll come to in a moment. I think there's just one contemporaneous document that I'm going to invite you to look at now, sir. It's at DHNI 5049_036. So this is a letter dated the 22nd of January 2001. It's from Dr. Anderson to Dr. Carson, Medical Director of Royal Group of Hospitals. And this concerns the first notification exercise with which Dr. Anderson had any involvement, so the 2001 notification. She provides a useful summary in this letter. I'm writing to update you on the current situation at the Northern Ireland Comprehensive Care Centre. I've now identified 6 patients who've been affected with the implicated batch. This includes 2 adults and 4 children. And then in the next paragraph, she deals with the issue of patient notification and says this: with regards to the action being taken to inform or not inform patients, as you know, there was considerable controversy over whether or not patients should be informed, and if they were to be informed, in what manner. As you are aware, a letter was sent from the Haemophilia Society to its members and was received in Northern Ireland on Friday the 19th of January. She encloses a copy of that and then says, I've tried to gauge how different haemophilia centres have approached the problem around the UK. The Scottish centres are minimally involved as they do not use BPL products. The Welsh Centre in Cardiff have informed all their patients, 17 last week, by phoning them and asking them to come up to the Haemophilia Centre and thereafter informing them with appropriate counselling. In Sheffield, a different approach was taken, following along the lines of Dr. Frank Hill, the chairman of UKHCDO. A letter was sent from the Sheffield Children's Hospital on Wednesday, and it would appear that the majority of parents want to know if their children have received the implicated batch. Over the page, again, this is in relation to Sheffield. On the other hand, in the adult population, only a minority wanted to know, and there's reference there to information that Dr. Anderson had received from Dr. Macris. She then says, I do know that 2 hospitals in London, the Oxford Haemophilia Centre and the Canterbury Haemophilia Centre, are directly informing their patients. After several lengthy discussions with Dr. Dempsey, who has the majority of affected Factor 9 patients, it was felt appropriate to take the situation forward in Belfast by directly writing to affected patients, all of which now parents of children involved, outlining the situation and asking them to ring Dr. Dempsey urgently. The mother will also be informed by Dr. Dempsey. It is hoped that this counselling will take place later this week. And then there's a reference to another adult patient described as being a prominent member of the Haemophilia Society. And then Dr. Anderson says this: it was felt both by myself and also by Dr. Maine, with whom I discussed the situation on Saturday morning, that it was essential he was informed. The patient was counselled by myself and took the information relatively quietly, with the comment that this was probably inevitable for any patient receiving plasma-derived blood products. And then there is discussion about the problem about whether or not to inform patients with antithrombin 3 who'd received the antithrombin 3 concentrate. She describes how there are relatively few centres where that arises, the only other identified centre being at the Royal Cornwall Hospital. And if we go to the next page, she says, she refers to anticipating Department of Health guidelines, says perhaps it would be appropriate to wait until these guidelines are available prior to informing the patients who've received the antithrombin 3 concentrate. There are also implications for informing other patients who've received immunoglobulin G, albumin and other plasma-derived products from this affected donor. This obviously involves UK-wide population. I'm concerned that I may be accused of withholding information from one set of patients whilst informing another set of patients. This is of concern, and she raises concern about whether that's professional misconduct. And then says, at the end of the day, I think this is an extremely complex situation. Dr. Dempsey and I have chosen to approach the situation by considering our centre on a particularly individual basis. So that's an account of Dr. Anderson's thinking in January 2001. There is, as I say, a very detailed account from Dr. Anderson in her witness statement, and I think it covers some 30 or so pages of her statement, and I'm obviously not going to go through it all now, but I'll just flag up, if I may, where the relevant passages are, and then just look at a couple of them. So it's WITN 4027001. Her evidence in relation to VCJD starts on page 140. And she deals in paragraph 83 of her statement, which runs through to page 144, with the circumstances in which she became aware of possible risks of transmission of VCJD. So I'm not going to read through that, but that's where she sets out her background knowledge and understanding. If we then go to page 144, the bottom of the page, she's asked the question, how and by whom were decisions taken, either nationally or locally or both, as to the information that should be provided to patients about VCJD, and as to any steps which should be taken in relation to patients and their care and treatment. And then she deals with the position at both a national and a local level. Her statement also covers Edinburgh because she moved from Belfast elsewhere, I think, and then on to Edinburgh. So if we go over the page, there is then a useful summary on this page and the next of the notification exercises. So we can see at the top of the page, paragraph 84.1.1, she refers to the first notification involving BPL products in January 2001, refers to the proposed approach from UKHCDO, and in the next paragraph she talks about there being a consensus view that patients had the right to be informed of receipt of an implicated batch of product. If we go further down the page, she refers then in paragraph 84.1.3 to the Haemophilia Society letter, and we saw that referenced in Dr. Anderson's own letter a few minutes ago. We see reference in 84.1.4 to a draft letter being circulated by UKHCDO. And then if we go, so that's the 2001 notification in a nutshell in terms of what was considered on a national level. If we go over the page, she then refers to the second notification involving SNBTS products in November 2002 and gives details of what advice was received at a national level in relation to that. And then in paragraph 84.1.7, she refers to a further notification process in September 2004, which in fact was completed after she'd left her position as the director of the centre, and refers there to the national discussion in relation to that. And then she goes on to talk about, if we go further down the page, discussions at a local level, and we've seen one example of that in the letter we looked at. So she gives an account in relation to the first notification exercise of local discussions in January 2001. We go over the page. She gives information about an urgent meeting convened to discuss it. She then gives similar information in paragraph 84.2.2 about the second notification exercise. And again, I'm not going to read through it, but we can see that's where it's located within her witness statement. And if we continue down the page, she refers to there being ongoing discussions in relation at Scottish and Northern Ireland Haemophilia Doctors Group and so on. If we go over the page, we can see in paragraph 84.2.5, she says, as the second notification involved SNBTS product and affected patients in Scotland and Northern Ireland, it was felt appropriate to inform patients through a notification process in the same manner in both regions and at exactly the same time, with the same letter, albeit with minor local modifications to reflect the prior notification exercise in Belfast. And then she gives further information following that about the 2004 notification exercise, and explains, if we go just a little further down, at paragraph 84.2.8, that she wasn't involved in final decisions about the exact nature of the notification exercise in 2004 as she left her post. And then if we go on to page 150, There is then question 85, what was the process at Belfast, also at Edinburgh, but I needn't refer to that for present purposes, for informing patients about possible exposure to VCJD. And again, she goes through the detail, if we follow over the page, of the procedure that was adopted to identify patients and ascertain what information to provide. And that is a detailed account which continues, I think, over the page until page 153. And if we just pick it up at paragraph 85.1.8.5, so the third paragraph down, she refers to recalling very few telephone calls to the centre and no patients requesting counselling following the letter. However, at clinic visits, patients did seek more information about the situation in general, and this enabled a general discussion to take place and any queries to be answered. And then in the following paragraph, she says, I found in general that the majority of my patients did not wish to be informed of an implicated batch in the future. We recorded the patient's wishes in the case notes. And then there's the BPL antithrombin 3 discussion, again, we saw alluded to in the letter from Dr. Anderson. And over the page, we see details being set out of the procedure followed. If we go to page 155, we can then pick up the picture in relation to the 2002 notification regarding SNBTS. And again, there's a detailed account from Dr. Anderson about the procedure that was adopted. And that continues for most of the following page, page 156. She also gives such details as she's then able to on the following page about the notification regarding the third implicated batch. If we go on to page 158, there's then also a detailed account of how and when patients were provided with information. And as I say, that continues again over a number of pages. And I'm not going to go through the detail of that. If we pick matters up on page 163, she then, in response to question 88, sets out what information was provided to patients about risks of VCJD at the Belfast Centre. And she summarises that on page 163 and over the page onto page 164. And then if we turn to page 165, she's asked about counselling support and advice and says in paragraph 89.1.1, so thank you, Shemik, in relation to the 2001 and 2002 notification exercises, she refers to helplines, counselling being available through face-to-face sessions with herself and the associate specialist should patients wish it. Patients were also given counselling and support and updates at review clinics. And then she also refers to the availability in 2001 of face-to-face sessions at the paediatric centre if required. And then finally, if we go to page 166, the question is asked at the bottom of the page about measures put in place regarding VCJD at the Belfast Centre from a public health perspective. And she begins to answer the bottom of the page. In January 2001, to the best of my recollection, there was no advice available regarding the public health measures required in relation to the care and treatment of patients who'd received factor concentrate. She explains she raised this issue with the Director of Public Health. The next paragraph, she explains it was problematic. She recalls an instance when the dental school at the Royal Hospital site required to shut for decontamination of surgical instruments. She refers then to all surgical instruments and ventilators being quarantined for patients who'd received implicated batches of product, many of whom had not wished to be informed of their exposure. Patients were not able to undergo endoscopy and colonoscopy as the public health risk had not been clearly defined, leading to waiting lists for procedures and delays to diagnosis. From discussion with other centre directors at the time, this was a common situation around the UK and not unique to the Belfast Centre, and again that accords with the evidence the inquiries heard. She then refers to further revised guidance in 2003 regarding decontamination of surgical instruments, and again refers to endoscopy being viewed as a high-risk procedure, so endoscopes were quarantined and reused for single patients. Then says in paragraph 91.1.6, with such practical difficulties for the multidisciplinary teams in terms of knowing which patients had wished to be informed and those who wished not to be informed, to the best of my recollection, around 2003, I think we took a pragmatic approach at the Belfast Centre to apply the same infection control measures to all the patients. As this involved quarantine of only some surgical instruments, this was relatively straightforward. Operating theatre staff would be informed of the need for disposable instruments, and it seemed that these were becoming more commonplace in use. And then she refers to her recollection about the position in 2004, and then explains again that she wasn't involved in the execution of the 2004 VCJD notification exercise. There is then some further evidence in the pages that follow from Dr. Anderson about some specific issues relating to the antithrombin 3 product notification exercise and various communications that Dr. Anderson had at the time. But as I say, it's a very detailed 30-plus page account from her perspective of what's happened in Belfast in relation to VCJD. So in our written note, we have sought to summarise Dr. Maine's involvement with UKHCDO as chair in 1990 to 1993. We've referred to her membership of the Haemophilia Society's medical advisory panel, which she seems to have been on from 1982 to 1994, although there's little documentation revealing the substantive content of her involvement. And we've referred to her appointment as trustee of the Macfarlane Trust between 1991 and 1996, and then her appointment to the Eileen Trust from 1993 to 1996. I'm not proposing to deal with any of those matters now because the focus yesterday and today is upon Belfast, rather than some of Dr. Maine's later and more national activities. We've also, in the written note, highlighted some documents describing interactions that Dr. Maine had with pharmaceutical companies. We've looked yesterday at some of her exchanges with Spaywood. There are bits and pieces of correspondence, for example, Dr. Maine providing an account of a named patient requiring haemophil to a pharmaceutical company, discussions about patients' adverse reaction to high 8C, again with Spaywood. There is some evidence of sponsorship by pharmaceutical companies of attendance at conferences. So, for example, there is documentation to suggest that Spaywood sponsored Dr. Maine to attend a conference to present a paper on porcine factor. There is also some evidence of Dr. Maine having a role, perhaps in her capacity as chair of UKHCDO, with an inspection of the Octopharma plant in Vienna in 1992, and attending with Dr. Lee, Dr. Jones, Professor Peake and Professor Preston to obtain detailed information about the fractionation procedures. That was at the time of an outbreak of hepatitis A. Those are, in broad terms, the interactions that the documents reveal in relation to pharmaceutical companies. If we go to Dr. Maine's own statement, WITN 0736009, and it's first of all, if we turn to page 13, paragraph 11.1, bottom half of the page, She suggests that the relationship which existed between the centre and pharmaceutical companies was businesslike and professional. And then, if we turn... Sorry, forgive me, sir. Will I find the page reference to page 70? She says, bottom of the page, she's never provided advice or consultancy services to a pharmaceutical company. At the top of the next page, never received pecuniary gain. And then if we look at paragraph 117, never received any financial incentives from pharmaceutical companies to use certain blood products. And then she says at 118.1, I believe it became known throughout the pharmaceutical industry that I was unreceptive to gifts. If a company product was in use, or if a pharmaceutical company so desired, educational gifts at the centre or extra accessories for the patients were acceptable, i.e. slides, pamphlets and books. She refers then to getting sponsorship for the meeting on hepatitis C. That's the hotel conference she describes elsewhere in her statement in 1995. And she says funding was accepted for travel to scientific meetings, either to present a paper or take part in discussion groups. So that is, again, an outline of the position in relation to involvement with pharmaceutical companies. It's perhaps relevant to note that following her stepping down as chair of UKHCDO, but while still an active member, in September 1994, the minutes of the UKHCDA meeting record Dr. Maine introducing a paper setting out a process for Haemophilia Centre directors to make declarations of interest, which was agreed, and it doesn't appear that there had been any such requirement prior to that, in relation to UKHCDA rather than local trusts. So that's the documentary evidence and the thrust of the witness statement evidence received in relation to policies and practices at the Belfast Haemophilia Centre.
Yes, well, thank you very much. So, tomorrow we have Dr. Benson.
Tomorrow, Dr. Benson at 10 a.m.
10 o'clock. 10 o'clock it is.
Thank you, sir.